Welcome back, everybody. I hope you had a lovely lunch. The afternoon session is on identifying individuals at a higher risk for firearm violence. And just to set the stage for this session, our goal is to obtain an understanding of the context and challenges of identifying individuals during the clinical encounter who are at a higher risk for firearm violence. Firearm violence occurs when 4 conditions are present, and I'll talk about those in a minute. Healthcare providers must be aware of both non-modifiable, in other words, risk groups, and modifiable risk factors that can be addressed with an intervention. Providers should know how to approach and prioritize the modifiable risk factors and have interventions available. So our panel is constructed. We have 3 fabulous panelists who I will introduce in a moment. And we're constructed that each will provide maybe about 5 minutes of opening remarks to frame how they think about identifying higher risk individuals. Then we'll have some dialogue amongst the panelists, and then we'll open the floor for questions from the audience and from the virtual audience out there. So please feel free to send your questions in. I'll open the panel by using this picture because I'm a very visual person. People who are into injury research are very familiar with the Hadden Matrix, and this really is almost a visual representation of the Hadden Matrix. But I like it a lot, and this really evolved over the past 2 decades in our team, which is highly interdisciplinary, where people said, well, I don't see a place for me in this. But I like this picture because it tells us a couple things. It tells us that 3 things really have to come together for a firearm injury or death to occur, right? A potential victim, these are our patients, the presence of a firearm, and a potential instigator, who is also our patients. So let's think about these as patients in our clinical encounters. These 3 have to come together for an injury to occur. Now, in a self-inflicted injury or an unintentional injury where a child shoots himself, the instigator and the victim are one and the same. But this is a helpful thing. It also helps us think within the environments in which firearm violence occurs that really do provide many modifiable opportunities for intervention. So as we think about keeping this injury, the injury event from happening, we can think about the 3 paths into an injury. We can think about the environments in which the injury occurs, and we can think about it in terms of both risk identification, identifying higher risk situations or patients, as also as protective factors, because everybody has both. So if we have lots of protective factors, we may change our risk stratification of individual patients. Clearly, the outcomes, as you heard this morning, are important because these can circle back and contribute to a secondary or an additional injury occurring. But this is just helpful to have in our minds to think all I have to do is interrupt one path or change an environment to really prevent firearm violence from occurring. So I'm just doing that to situate the discussion. And now I'm going to hand over the podium to our first panelist, Baer Merritt, who is an associate professor of pediatrics and associate division chief of academic general pediatrics at Boston Medical Center. Dr. Baer Merritt is a general pediatrician and child health services researcher. Her research is focused on screening for and responding to intimate partner violence in the health setting, the impact of family violence on child health, and interventions to partner with families to promote resilience and child well-being.